Navigating the labyrinth healthcare for people with disabilities. Accessing healthcare can feel like navigating a complicated maze, even for those who are generally healthy. The complexity of the system can be daunting, with its myriad of forms, appointments, and medical jargon. For people with disabilities, the journey can be even more challenging. Physical barriers, communication hurdles, and a lack of understanding from healthcare providers can add layers of difficulty. From finding doctors who truly understand their needs to navigating complex insurance systems, the obstacles can feel overwhelming. The frustration of dealing with inaccessible facilities and untrained staff can be disheartening. This guide is designed to empower people with disabilities to become their own best healthcare advocates. By equipping yourself with the right information, you can take control of your healthcare journey. We'll break down legal rights, offer practical tips for finding the right providers, and provide strategies for effective communication. Knowing your rights and how to assert them is crucial. Remember, you are not alone in this journey. There is a community of support available to help you navigate these challenges. This guide will equip you with the knowledge and tools you need to navigate the healthcare system with confidence and ensure you receive the care you deserve. Empowerment comes from being informed and prepared. Let's begin by understanding the legal framework designed to protect and support your healthcare rights. Knowing the laws and regulations can make a significant difference in your healthcare experience. Know your rights. The ADA and ACA as your healthcare allies. These two pieces of legislation are designed to protect and empower you in the healthcare system. The Americans with Disabilities Act, ADA, and the Affordable Care Act, ACA, are two landmark pieces of legislation that have significantly improved healthcare access for people with disabilities. They have transformed the landscape of healthcare, making it more inclusive and equitable. The ADA prohibits discrimination based on disability, ensuring equal access to healthcare facilities and services. This means that no matter your disability, you should receive the same level of care and respect as anyone else. This means doctors' offices, hospitals, and other healthcare settings must provide reasonable accommodations to ensure accessibility for everyone. These accommodations can include ramps, elevators, and specialized medical equipment. The ACA, on the other hand, has expanded health insurance coverage and introduced important protections for people with disabilities. It has made it easier for individuals to obtain and maintain health insurance. This includes prohibiting discrimination based on pre-existing conditions, which was a major barrier to accessing affordable health insurance for many. Now, people with chronic illnesses or disabilities can get the coverage they need without fear of being denied. Understanding your rights under these laws is crucial. Knowing what you are entitled to can help you navigate the healthcare system more effectively and ensure you receive the care you deserve. If you face discrimination or barriers to accessing healthcare, you have the right to file a complaint and seek legal assistance. There are resources and advocates available to help you fight for your rights and ensure you receive fair treatment. Finding your healthcare heroes, a guide for people with disabilities. Finding healthcare providers who are knowledgeable, compassionate, and experienced in treating individuals with disabilities is paramount. Start by asking for referrals from your network, including disability organizations, support groups, and other individuals with disabilities. Online directories specializing in disability healthcare can also be valuable resources. When researching potential providers, look for those who explicitly state their experience and commitment to serving people with disabilities. Don't hesitate to ask direct questions about their experience, accessibility of their office, and communication practices. Finding the right healthcare providers can make all the difference in your healthcare journey. Decoding insurance, making sense of coverage options. Navigating the world of health insurance can be daunting, but understanding your options is essential. It can be overwhelming to sift through the various plans and policies, but taking the time to educate yourself can make a significant difference. For people with disabilities, there are several avenues to explore, including Medicaid, Medicare, and private insurance. Each of these options has its own set of benefits and eligibility requirements, so it's important to understand what each one offers. Medicaid is a joint federal and state program that provides health coverage to low-income individuals and families, including those with disabilities. It covers a wide range of services, from hospital visits to long-term care. Medicare, on the other hand, is a federal health insurance program for people aged 65 and older and certain younger individuals with disabilities. It includes different parts that cover specific services, such as hospital insurance and medical insurance. Private insurance plans are also available through employers or individual markets. These plans can vary widely in terms of coverage and cost, so it's crucial to compare different options. When choosing a plan, carefully review its coverage for essential services like doctor's visits, prescription drugs, and therapies. Make sure the plan meets your specific healthcare needs and budget. Speaking up for your health communication and advocacy tips. Effective communication is the cornerstone of a successful patient-provider relationship. For people with disabilities, clear and open communication is even more crucial. Before your appointment, prepare a list of your conditions, medications, and any concerns you may have. During the appointment, don't hesitate to ask questions, request clarification, and advocate for your needs. If you experience communication barriers, explore assistive devices or request an interpreter. Remember, you have the right to understand your health information and participate fully in your care decisions. Prepping for your appointment. A checklist for people with disabilities. Preparing for medical appointments can help ensure your needs are met and your time with the provider is productive. Start by gathering all relevant medical records, including test results, specialist reports, and medication lists. If you require specific accommodations, such as a sign language interpreter or accessible equipment, inform the doctor's office in advance. This allows them to make necessary arrangements. Consider bringing a trusted friend or family member to the appointment for support and to take notes. Having someone with you can make the experience less stressful and ensure you don't miss any important information. Beyond the doctor's office, managing ongoing care and support. Managing a disability often involves more than just doctor's visits. It may require coordinating care with specialists, therapists, and other healthcare professionals. Establish a system for keeping track of appointments, medications, and treatment plans. Consider using a planner, smartphone app, or online tools to stay organized. Don't hesitate to reach out to your healthcare team between appointments if you have questions or concerns. Strong communication and proactive self-management are key to navigating ongoing care successfully. Your mental well-being matters. Coping with the emotional side of disability. Living with a disability can bring unique emotional and mental health challenges. It's essential to prioritize your mental well-being alongside your physical health. Seek support from therapists, counselors, or support groups specializing in disability issues. They can provide coping strategies, a safe space to process emotions, and a sense of community. Remember that seeking help is a sign of strength, not weakness. Taking care of your mental health is just as crucial as managing your physical health. Taking charge of your health journey, empowerment, resources, and hope. Navigating healthcare as a person with a disability may have its challenges, but you are not alone. By understanding your rights, finding the right providers, and advocating for your needs, you can access the care you deserve. Remember that knowledge is power. Equip yourself with information, connect with disability organizations and support groups, and never hesitate to ask for help. Your health journey is unique and you are your own best advocate. By embracing your strength, resilience, and the power of community, you can live a full and healthy life.